Students, cruising through the last section of this chapter, we'll talk about how an infected person is getting treated. That is principles of treatment. So, what are the primary things that we should think about? First is reduce the effect of disease. Firstly, we eliminate the symptoms. All right, that is our primary area. We have to provide relief to the particular patient, and for that symptomatic relief, we have to reduce the effect of the disease. Treatment reduces effect of the disease without killing of infectious agents, and this is carried out by two methods. First is symptomatic treatment, and second is rest. That's why if a particular individual is having any kind of disease, what is the first thing that is advised? Lie down and take a good rest. All right. So reduce the effect of disease with symptomatic treatments where medicines are being administered to treat the disease symptoms related to any kind of inflammation or swelling, along with fever, pain, sneezing, coughing, loose motions, etc. can be reduced, or their effect can be reduced with medicines. Medicines bring down the fever. That kind of medicines are known as antipyretic drugs. Reduce pain are known as analgesic drugs like typical paracetamols, and don't abuse them, okay? Only take them when your doctor advises it. And control motions, that is your loose motions, or you can say bowel movements, which is antidiarrheal drugs, or to sneeze and coughing to release, or you can say to reduce that, anti-allergic drugs are being given. Depending upon kind of symptoms that a particular person is showing, any kind of drug or this medicine can be given. Okay. For now, second is bed rest. Bed rest, that is also known as rest, is a cure to any kind of medical treatment in which a person lies in bed for most of the time so that their body works minimally, and their body can work upon the internal matters, we can say, or the pathogens that entered uninvited in the body efficiently and smartly. All right, because an occupied individual in any sense won't be having a good chance of recovery. Okay, there's an English saying that everyone might be knowing, that jack of all trade is master of none. All right, so killing the microbes with infectious agents like bacteria, viruses, fungi, helminths, and protozoan have some essential biochemical life processes. Like we have spoke about how malarial parasite grows, likewise every kind of pathogen grows in the body. Some drugs directly affect those life cycles or growing reactions, and they eliminate it at the first place. First they stop the growth of that organism, then they contain it and eliminate what's being damaged or what's been affected at the first place. All right. So sulfa drugs prevent the folic acid synthesis in bacteria. Like human brains do not require this process. Penicillin prevents cell wall synthesis in bacteria, while human cells are without a wall. Okay. Similarly, there are drugs to kill protozoans like malarial parasites and helminths like roundworms. For almost every kind of diseases, drugs are there. All right. Viruses do not have their metabolic machinery. That's why it is very difficult to kill them. All right. They enter cells and use our machinery, our body cells mechanism to multiply, to perform their life process. They have only few biomechanical mechanisms, so we can only target these few biomechanical reactions that are occurring in our body so that we can stop that. Okay. So because of this particular reason, there is no definitive curative treatment for HIV infection as such. Why? Because of this process only, because our body cells are getting manipulated by this virus, and it is using our machinery. Our immune system is getting compromised, not because of this, but this is influencing our immune system that everything is all right, and because of which what happens, the person is open to any kind of disease. All right. Prevention is always better than cure, because every prevention or every infection brings us misery, confusion, and an affected person, but also to the others who are being associated that the person. Principles of prevention include damage. Wherever there is infection, damage occurs, or we may find some kinds of signs or symptoms in one or other body functions that may not be the same ever again. Loss of working days, If a person is getting affected by any kind of disease, they may not able to work properly. They require rest, okay? And that's why the proper working days are getting compromised or reduced, okay? And it is a very difficult process through which again the person has to gain that momentum that has been lost. So for that not to happen, maintain a constant good diet and hygiene. All right. Source of further infection in which a person, if or if not, may be suffering from any kind of infection, that should be or that can be avoided by containing that particular person in an isolated, safe environment so that other individuals can be safe. That is well seen in the coronavirus scenario for the last for back 2-3 years. Now we talk about, and that's how it gets completed. Thank you for your time and patience to the listening, and I hope it had been found very helpful for one and all.